Thank you so much. We're so excited that you're here today. Thank you for joining us. We're really excited about the discussion we're going to have today around supporting our staff with vaccination. We're hopeful that today's session will help you in answering any questions you may have or any concerns or anything like that. Today, we're really trying to do the best that we can to give you as much information as possible. As you know, we are up next in terms of getting vaccinations, so we want to make sure that our staff, faculty and staff have all the information available to move forward. So I'll kick it off to our Chief Officer of Support, Ms. Stacy Dupree.
Hello, and it's our pleasure to meet with y'all today, and we have a wonderful panel of doctors who will be providing a presentation information. But the first thing I'd like to do is I'd like to give you an overview on the next slide of our agenda. So we're going to have an overview of the Health Advisory Committee. In our district, we have a group of medical professionals that provide us guidance on the Health Advisory Committee. So I'm going to give you some brief updates. So one of our updates, the goal of our committee is to meet and evaluate local and state trends and develop district-based COVID-19 recommendations and practices. And as you look at the screen, you'll see that we have a cross-section of individuals on this committee. Of course, we have our superintendent, Dr. Narcisse. We have Dr. Catherine O'Neill from Our Lady of the Lake, Dr. Michael Bolton, Dr. Dawn Marcel from LDH, Dr. Sylvia Sutton from OLOL, Chelsea Alexander from LDH Region 2, Kristen Gradney with OLOL, Cherie Duvac, and myself, Stacy Dupre. So I'd like to move on to the next slide. As we continue to provide the most effective same-day COVID testing at our health centers and school sites, we are offering testing for our students and staff. If they have any questions about possibly, do I have symptoms of COVID? We have a telehealth system where they call in, we set up an appointment, and they can drive through, and our staff and students can be tested for COVID. We continue to work on contact tracing, deep cleaning, and continuously monitoring the CDC and LDH recommendations as part of our day-to-day operations. We've looked at our data for the month of January. We've seen less than 0.9%, so that's 0.9% of a positivity rate since we started working face-to-face with students, and that is amazing. As you know, in our parish, we're considerably higher than that, so 0.9. I'm really proud of our staff and all our teachers and everyone and the work that they're doing out there to protect themselves and our students. We are also actively preparing for the vaccination distribution and administration. That's our next stage. As we move on to the next slide, as we move forward, I would also like to remind everyone that the questions that we'll be discussing today and the topics that we will be discussing today have to do with vaccinating our employees and also the COVID-19 vaccine. So we'll be taking questions at the end. At this time, I'm going to turn it over to Ms. Kristen Gradney, the Senior Director of Our Lady of the Lake Children's Health.
Hello, everyone. Thank you for having us today. I'm going to introduce to you our town hall panel, which is made up of experts from Our Lady of the Lake Children's Health. We have Dr. Michael Bolton, who is our pediatric infectious disease physician, Dr. Ashley Lucas, who is the Our Lady of the Lake pediatric medical director, and Dr. Sylvia Sutton, who is the Our Lady of the Lake Health Centers and Schools medical director. Dr. Sylvia Sutton will take us through the presentation today, and then at the end of the presentation, all three of our physicians will be able to answer all of your questions. So I'm going to go ahead and turn it over to Dr. Sylvia Sutton. Next slide, please.
Hi, it's a pleasure to be here this afternoon, and of course I'm going to be presenting some just basic information about the vaccine availability and the vaccines, and then afterwards me and my colleagues will be able to answer any questions that you may have. As vaccine availability, the vaccine will be rolled out in phases as you've been noticing through the news and with the governor's press releases. but it's to ensure the most vulnerable and high-risk populations, including healthcare and essential workers, have access to it first. Public health authorities indicate it will be made available to broader populations over time and as the vaccine supply increases. Without question, our teachers and our frontline staff are our top priority, and especially those who are in the classroom and interacting with our students each day. So hopefully this will continue to decrease the infectivity throughout the schools. Next slide. So vaccine safety. The risks from contracting the disease are far greater than the possible risk from getting the vaccine. Current data from the manufacturers for the vaccine, validated by the FDA, strongly indicate that the vaccines are safe and effective. There are no reported serious safety concerns from the current vaccines. As is their practice, the CDC and FDA will continue to monitor the vaccine as it's been given through the general population. Next slide. So a little bit about the vaccine safety and side effects. Some questions that have been posed. Can I get COVID from the vaccine? No, it is not possible to get COVID from the vaccine. The vaccines from Pfizer and Moderna only use a gene from the virus, while other vaccines being studied use inactive viruses. So none of these can cause COVID-19. Are there any side effects from the vaccine? To date, no significant safety concerns have been reported, but there are some mild to moderate side effects, such as fatigue and headache. We know that there is a small risk of side effects associated with all vaccines, but the side effects are often less serious than the disease itself. We believe the vaccines are safe and effective and only move forward according to the rigorous review of our well-established clinical protocols. Next slide. So as the vaccine becomes available, there is a process that will be put into place. A survey will be distributed to determine who is interested in getting the vaccine and any little medical history that that person may have. Once the EBR public school system is notified of the date the vaccine will be received, appointments scheduling will occur. Vaccination will take place at designated locations, which you will be notified by Our Lady of the Lake and health centers and school clinical staff. And then a second dose vaccination will be scheduled for 3 to 4 weeks later, depending on which vaccine has been administered. Then you would report to the designated locations at given time at the appointment time for the second dose of the vaccine. Next slide. What to expect when you get vaccinated. So the Pfizer and Moderna vaccines are given as 2 shots in the upper arm muscle 3 to 4 weeks apart. This typically, it takes about 2 weeks after the second dose, the second shot, for sufficient immunity to kick in. Even after the vaccination, you might be able to pick up the virus, carry it, and give it to others. So infection prevention measures are still very, very important. Next slide. So we're open to any questions that you may have regarding the vaccine and prevention.
So I'm going to moderate as the questions come in. I'd like to remind everybody that we're focusing on questions about educators receiving the vaccine, any questions that they have, and questions about the vaccine itself. So I have a question that's come in. When shots are available for teachers, will school nurses provide COVID-19 vaccine shots at their school service locations? I don't know if the doctors can address that, but I will share what we've discussed so far with our advisory committee. We're looking at central locations to see where we have the most need for the vaccine and what areas can we roll it out the most efficiently. As we move forward with that, we are definitely going to share this information with our employees so they know where to go. As we said earlier, as a survey will be going out for us to look at the data of how many people, what areas would like to receive a vaccine? So I'm sorry, doctors, I thought that was more of a internal question. So let me move to the next question. Please explain to the audience the difference between a messenger RNA genetic material from the virus versus genetic material from people, such as an unborn children. Also address that there are no biometric tracing or tracking information made inside the vaccine dosage. Could y'all please address that for us?
I can try to take that one. I think my best analogy about what mRNA really is to liken it to a photocopy of a recipe that you've taken from a huge book on your shelf in your living room, and you've just taken a photocopy or you've handwritten a copy from that recipe book and you're taking it into your kitchen. That's what mRNA is like. It's like a little snippet of a copy of your DNA that's in your genes. It's not really a gene. It can't do anything to your genes. The mRNA is just like a little piece of paper to cook the recipe, and then actually it goes away after a little while. It's not really meant to last. It gets degraded quickly. So when we inject this piece of mRNA into the cells in the arm muscle where the shot goes in, your body is used to interpreting that as direction to cook the recipe, to cook the cake or whatever. And so your body starts decoding it and making something. And in this case, you're making the little spike protein that's on the surface of the real COVID-19 virus. But you do not get injected with virus. You do not get injected with an actual gene, really. It cannot alter your genes. It cannot hurt. There's no biologically plausible reason why it would hurt a baby or affect fertility later. These are sort of rumors that have floated around, but this is actually a very clean, elegant way to vaccinate someone. This technology really started about 30 years ago, and the need and the huge outpouring of funding and resources and sharing of information allowed it to come to the surface pretty quickly so that we could get this vaccine made. But I think that answers the question in terms of, kind of putting it into perspective of what the mRNA is. Nothing about this vaccine can alter who you are or alter a future baby or your genes or anything like that.
Thank you so much. Our next question is, what is your recommendation for women who are pregnant?
I can take that one too and then pass it on to Dr. Bolton or Sutton. I think that every pregnant lady needs to consider the pros and cons of what COVID itself might do to her. We know pregnancy is a higher risk group, and she may have high blood pressure or be overweight or something else that puts her at a higher category. There's not been a lot of study of pregnant women getting the vaccine. In the early trials, they were excluded. However, a few of them did get pregnant during the trials and apparently did okay. The virus itself would be worse, I would think, than getting the vaccine. So, that's an individual decision and there's no formal recommendation on it. But I think down the line, we'll see that it's just like the flu vaccine. It's actually recommended for pregnant women because they're in a higher risk category, and there have been deaths of women and their babies after catching COVID, unfortunately.
The next question is, will it be Moderna?
I can try to answer that, although Kristen might be a better person for that. But I think it's sort of going to be the availability of the vaccine whenever the time comes for immunizations to occur.
That is correct.
So we have a question. It's more of an internal question. Will we be allowed to use our COVID time off if we get side effects from the vaccine that affect our teaching? I will tell you there's some questions that are coming in that perhaps we cannot give you full answers today, but we will have a FAQ document available after the both town hall meetings to address all these questions. So I really appreciate that question. So let's move on to the next one. How long does a vaccine last in the body?
Hey, it's Michael Bolton. I can try to take that one. So the vaccine itself doesn't last very long in the body. What the idea of it is to, as Dr. Lucas mentioned, sort of mimic what the virus, what COVID does in the body to prompt an immune response from our own immune systems, so that should it see it again, it can develop a quick attack on the virus when infected. The idea of how long the vaccine will stay effective, that's to be determined. Researchers are still looking at that to determine whether or not this is going to be a one-time vaccine dose, or will this be something where you get it annually, similar to the flu shot? Or will it be something where you get a booster every 5 years or so? Those are some of the questions that scientists around the globe are still trying to answer, and hopefully we'll have some of that information soon to be able to share that with y'all.
So as a follow-up question to that, we have several questions asking how often will the shot have to be administered? Will it be every 6 months, yearly? If y'all can address that if you haven't done so already.
Yeah, sure. So I think we just don't know yet whether or not this is going to be a one-time vaccine administration or something that's done annually, similar to the flu shot. Whether or not the variants continue to pop up that we've seen in the news from various parts of the world, whether or not that will play a role in having our scientists develop slight variations of the vaccine in order to address those variants, similar to what the flu vaccine adjusts on an annual basis to make sure we have immunization against the various flus. So that's, I think, something to be determined, and we'll hopefully know that hopefully soon.
We have additional question about who will be receiving the vaccine when. We're still working with that with our leadership team, but our focus is to provide our frontline employees first. So doctors, we have another additional question. How old do you have to be in order to take the vaccine?
I can try to. So the studies so far that have been done have been individuals who are down to I believe 16 for Pfizer and 18 years for Moderna. So that's the youngest folks that were evaluated in the trials. I know Pfizer has enrolled, I think, 2,000 kids in a pediatric cohort, and I know Moderna is recruiting sites to start their pediatric trials for the vaccine. But at the moment, I believe it's 18 for Moderna and 16 for Pfizer. That's been studied in trials.
Thank you. Our next question is, what can I do to protect myself from getting COVID until I'm able to get the vaccine?
I can take that. As the pandemic has been going on, it's all the mitigation processes that have been put into place. The wearing of your mask, covering your nose down to your chin, across to your ears, and washing your hands frequently, using hand sanitizer, monitoring for any symptoms, and also then the social or physical distancing and not congregating amongst other people. So that's really how you can protect yourself.
I have a multi-part question. 1, do I have to get both shots to be protected? If so, how long do I have to wait before it's effective? And if I only get one shot, how much protection do I have?
It seems to be with this vaccine that the first shot is not very protective. It primes your immune system. But that second one really gives you the immune boost that you need to truly be very effective. They're saying something like 95, 97% effectiveness against preventing severe disease or hospitalization or death. But it's this, you really need the second one, and you can really only count on that degree of effectiveness in about 2 weeks after you get the second dose. So it's really important to get both.
We have a question from an individual who said that once they receive a vaccine, they've been informed that they cannot give blood for a plasma drop. Is there any indications that after you get the vaccine, you cannot donate blood or plasma?
Hey, this is Michael Bolton. I have not seen or read any sort of reason why you wouldn't be able to do blood donation after receiving a vaccine. Now there are some instances. Yeah, no, I was gonna talk about other vaccinations, but there's no indication that I'm aware of that getting a vaccine precludes you from donating blood or blood products.
Thank you. The next question. After receiving the shot, it's understood that PPE should still be used. If contacted again after receiving the shot, will the response be less effective after taking the vaccine? I think this question, what they're asking is, if I've taken the vaccine, the first dose, and then I get COVID, will the second dose be less effective? Do I have to wait until the second dose? And how does that work?
Well, I mean, it's better to have one shot versus nothing if you happen to catch COVID in between the two. I don't think that the vaccine is recommended during the time that you're febrile or sick or any of that. And presumably, if you truly have COVID, you should be immune for a little while. So, I mean, maybe Dr. Bolton could answer what exactly do you do in that situation. But the first question, I think, was, can you repeat the first question? It was sort of unrelated.
Yes, ma'am. The first question is, I've taken the COVID vaccine,
Oh, right.
and then I get COVID. What steps do I need to take? Do I go on and take the second vaccine, or do I have to wait?
I think the first question was actually originally, do I still have to wear PPE, the mask, and all of that after the vaccine? I think was also a question. And unfortunately, the answer is yes, you do have to continue doing all of those things. And the reason is that we don't know exactly whether people who are vaccinated with the COVID vaccine may still get very mild, asymptomatic cases of COVID and be fighting them off to the point that they don't even realize they have it, but still possibly shed it to others. And I don't think this has been documented well. It's just something that is going to have to be researched and followed with time. And maybe one day we'll get the clearance to not do all this if you've had the vaccine. But while we're still trying to figure it out, the safest thing for you to protect other people is to wear the vaccine, is to wear the mask. But I'll defer back to Dr. Bolton on exactly what to do if you catch COVID in between dose 1 and dose 2.
Yeah, that's a great question. I don't know that there were enough data in some of the pools where we're looking at the vaccine administration and efficacy of folks who did get COVID in the interim. I think the ones who did get COVID during that period between first dose and second dose, I think they still got the vaccine on the second dose. And whether or not that affected their immune response or impacted their ability to get the virus later, I'm not aware that they determined that or looked at that. So, but I think it's a pretty rare occurrence for that to actually happen.
My impression is that the vaccine actually gives you a better immune response to COVID than COVID. And so I guess if you already got one dose and you're not sick, then you might as well complete your series. It's not going to hurt you. But I don't know if there's a CDC recommendation for that one yet.
That was my next question. So I appreciate that. I'm going to circle back on that question, asking, I've had COVID. I've recovered. Should I go and get a COVID shot?
I think the answer to that is if it's been more than 90 days since you had COVID, then yes, if you're eligible for it, you should go ahead and get it. It's not wrong to get it sooner. It's just that that would be the longest you would want to wait, because that's about as long as we can pretty much feel confident that you're going to stay immune. It's about 3 months. And I've definitely known people who got COVID again, at least 2 people I know, and it was after the 3-month period.
Do I need to take the same vaccine, or can I take 2 different vaccines?
Oh.
It has to be the same one. They're both very similar, Pfizer and Moderna, but it's highly recommended that you receive both doses from the same manufacturer, just because it's not clear what that would do if you mixed them up. However, if they accidentally get given, it's not recommended at this time to repeat them or go backwards.
We have a question. What are the ingredients in the vaccines? I don't know if y'all can fully address it, but if you could give an idea. Some questions are, is it a live virus? Is it a protein? I think that's what they're asking when they're discussing the ingredients.
It's the mRNA, the little snippet of genetic material. That's the copy of your DNA that's meant to be the recipe or the code. It is not a protein. That mRNA triggers your body to make the protein in your cells, which is why it's just sort of beautiful that it can do this. This is the first, mainstream vaccine we've had that uses this technology. But it probably has a preservative, and I think it has a lipid coating that protects the mRNA, which is very fragile, from being immediately degraded as soon as it hits your body. So that is there to protect it. There is no thimerosal, I don't think, no formaldehyde, nothing that's thought to be toxic in any way. There are people who probably have sensitivities to the preservatives. That may be the reason that a few people have had allergic reactions, because no one should have an allergic reaction to the mRNA itself. Anything to add to that, my colleagues?
No, I agree. And really the difference between the vaccines is the same, to Dr. Lucas's point, mRNA coding, because they're looking for the same virus. It's the difference in sort of the lipid or the fat envelope that the mRNA is encased in that makes them a little different from the vaccine standpoint. But otherwise, it's the same. Yeah.
So as I move to the next question, will I be tested for COVID prior to receiving a vaccination?
No, you will not. Jump in on that one.
I'm catching up on the questions.
Good questions.
We have one. I don't know if the physicians can answer this, but we've had several people ask, will I be required to get vaccinated as an employee? No, all vaccinations are voluntary. I just wanted to share that, and we checked with our general counsel to make sure I use the correct wording. So, if I'm allergic to, for example, tree nuts, peanuts, latex, will I have an allergic reaction to the vaccine?
So it's the answer is probably not. Not able to wholly predict the future, but the likelihood of you having an allergic reaction to the vaccine is extremely rare. So it is unlikely for that to be the case, even if you have a history of allergies. That's part of the reason why after you get the vaccine, the site giving the vaccine watches you for 15 to 30 minutes to make sure there are no reactions or allergic reactions that might happen after getting the vaccine.
We have a question about the messenger RNA, the genetic material. Is this genetic material done from any fetal material, or unborn children? Is that components of the vaccine? There seems to be several questions about that.
No, there are no components of any of that in the vaccine itself. No.
What's nice is this vaccine didn't require eggs or cell cultures or the things that have been used in the past that would trigger those kinds of questions. So that's another nice thing about this newer technology.
Is it safe for me to get a vaccine if I have underlying medical conditions such as diabetes, asthma, etc.?
Yeah, it's probably way safer to get a vaccine under those circumstances that you mentioned than to take your chances with COVID. But every person should discuss with their own doctor, what their particular situation is.
I think we've addressed this already, but I have a question. What are the primary differences between the two vaccines?
I think the main difference is that one has to be held at Arctic temperatures that are kind of hard to do if you're not prepared for that. And the other one is more stable at room temperature. But other than that, they're very similar. Pfizer and Moderna, anyway.
Right, and you're right. The reason is because of the sort of the fat envelopes that they're in are a little different. And so therefore they need different storage temperatures, as Dr. Lucas mentioned. So that's really the main difference. The mRNA in them is the same to produce the immune response that you want it to produce.
The next question is it safe for me to get a COVID-19 vaccine if I'd like to have a baby one day?
I would say absolutely. There's things floating around on social media that got picked up based on some legitimate questions about a protein that could be possibly similar to the spike protein. But I guess the best explanation I can give is that if the spike protein that this vaccine generates and then generates an immune response to were to affect the placenta or fertility later, then the COVID-19 virus should do that even better. And we haven't seen any sort of suggestion that COVID or the vaccine does that. Fertility seems to be just fine in America.
So an additional question, we talked about, is it safe if you're a pregnant mother or breastfeeding? But I've had that question again, so I'd like to follow up. If you are currently pregnant or breastfeeding, is it safe for you to get a vaccine?
I mean,
You want to take it this time?
Yeah, I can take it. I mean, as said before, you probably should discuss it with your medical provider about the risk and benefits. But the Academy of Obstetrics does recommend that you consider it. It hasn't been studied, but there are slowly studies coming out regarding the vaccine with pregnancy and vaccine with breastfeeding. And actually with breastfeeding, there may be a benefit that the immunity is passed on through the breast milk. So it's something that you should consider and discuss with your own medical provider. But there are no risks known at this point.
Our next question is, what is herd immunity? And how do vaccines help with herd immunity?
So I could take a stab at it. I don't know that I have a very eloquent answer, but so it's really when a large group of people are immune to a certain infection, and so that the vast majority of them have been protected against it. And the idea of herd immunity is that if 95% of a population, let's say, is immune to a particular infection, and there's 5% who aren't immune to it, the idea is that it's hard for that infection to invade that population of people because the vast majority of them are protected from that infection. And so you have the herd sort of protecting the folks who aren't immune to that particular infection. And so the more people who are vaccinated, the greater the herd immunity. And so the more people who are vaccinated against COVID, the better chances of making the virus at bay, but also helps with minimizing the risk of variants that continually develop across the globe. And so the more folks that get vaccinated, the better the herd immunity, the better we are able to stem the spread of the virus.
Our next question is, if I get the COVID-19 vaccine, will I test for COVID-19 on a viral test? I'm sorry, will I test positive for COVID-19 on a viral test?
You shouldn't test positive on a PCR or a rapid antigen test, the kind that we use to tell if someone has COVID at that moment. It's possible, maybe Dr. Boulder can comment, but I think it's possible that your antibody test could turn up positive. Since you've had a vaccine, you're going to have antibodies against COVID. I think the jury's still a little bit out on that.
Right. No, you're right. You're right. Your PCR test won't test positive, but your antibody might, depending on which antibody test you're doing, because the Pfizer and Moderna vaccines, as Dr. Lucas mentioned, generate the spike protein. You would likely have antibody to the spike immune globulins, but for like the nucleocapsid antibodies, they likely wouldn't be present.
If an individual is immunocompromised, would you suggest they take the vaccine or not?
Generally, I think that the answer is yes, depending on the situation. But again, the vaccine can't make you have COVID or give you anything. So it just might be less effective if your immune system can't respond to it well because it's suppressed. But I believe that the general answer is you should absolutely get the vaccine because you'll do better with that than you will with actual COVID.
I've had a number of questions about specific conditions or specific medication. What advice would you give our community and our educators if they have questions about a specific medication they're on or a specific medical condition they have?
I mean, for those very specific questions, I think turning to your doctor for advice is always good. I'm not aware of any specific medications that people might be on that would preclude them from getting this vaccine. I haven't read anything like that. Have you, Dr. Bolton or Dr. Sutton?
No, I'm not aware of anything.
No, yeah, I agree, Dr. Lucas. I think generally speaking, it's usually going to be fine to get the vaccine, but I agree with talking to your provider whom you see for your condition, because each condition is a little different and you might be on different therapies. And so trying to make the best decision would be one that could be had with a discussion with your primary care or your subspecialty doctor who's treating you for the condition. But for the most part, vaccines tend to be very well tolerated and tend to preserve life.
So we've come to the end of our questions. Of course, as I said earlier, any questions that come in or continue to come in, we're going to have a frequently asked question and we're going to post the answers to the website. There have been a number of questions about the rollout. We will address that. We are still working on that. Within the next several days, the district will send out a survey asking for participation rate. Would you be interested in getting the vaccine or not? Please note, it's always voluntary to do a survey and it's voluntary to take a vaccine. Now I'm going to turn it over to Dr. Narcisse for our closing.
Thank you so much for participating today in our staff town hall meeting. It is important for us to get information out to you so you can be aware and also to know that we care a lot about our faculty and our staff. You are the most important people to help our students in this city to succeed. So your health is very important to us. And so if you have any questions, please do not hesitate to email, call, contact us. Just wanted to say thank you to our partners in this work, Dr. Sutton, there was Kay Gadney, our chief officer, Stacey Dupree, for helping us to set that up. and all the other partners we have as a part of the COVID task force and our health team that really has been really putting a lot of work into this noon and night to ensure that our staff and faculty are safe. Please know that tomorrow we will also have a town hall for our parents and our communities. And so it's important that we align our messaging to make sure that we keep their concerns intact. As you know, you are in the front lines working with our students to ensure that they have the right information. If you have any questions moving forward, please do not hesitate. Stacy, maybe we can give them an information where to email. Where would you like them to send that information?
Sure. If you have any questions, please feel free to email me. Let me spell my name for you. It's SDUPRE, only one E, at EBRschools.org. And if you're an employee, look up Stacy Dupre, one E in both names, Stacy and Dupre, and you can email me directly and I will get you an answer.
Thank you so much again for participating, and we look forward to seeing you. And we also look forward to keeping you safe as you help support our students in the city. Thank you. Have a good night.
Thanks to all of you educators. You guys are heroes.
Thank you.